Hey there, my name is Cloud, and this is me enjoying my runs and the best gifts of life with my ladies. You can say I'm passionate about running. Welcome to my channel dedicated to recovery, rehabilitation, and running. Thank you for joining me in this journey. Recover from the big C, and hopefully one day soon, run again. Hi, how are you? Another day, another grind. Let's get after this. All right. Um, Thank you for joining me in my adventures today and continuing on my current cross training program for rehab and recovery. And for those of you who have been following my channel, um, still at this, it's freezing cold outside. Really, no opportunities for me to get out and do any kind of run or walk or any cardio workout. So this is it for now. Coming up soon, possibly by next week, I'm hoping to increase my duration or my sets for the machine work that I'm doing. But stay tuned for that. Over the last couple of days, just to give you some heads up, I've been averaging about 125, 135 beats per minute throughout most of my workouts. Kind of where I want to be at this time. My rate of perceived exertion is usually about a 6 maybe. Or if I push a little harder sometimes, it could be a 7 out of 10. Breathing, it's just fine. I don't think I'm breathless or anything like that. So that's kind of where I'm at right now, and still working on this program for recovery and rehabilitation. But for today's reflections, I just kind of really want to highlight some lingering things that I've noticed or I've been noticing, and it's been about a little over 3 months and a week since after my lung surgery, my lobectomy, removal of the right lower lobe of my lung. And there's a few things that I want to share with you today. So the first thing that I've noticed is my level of breathlessness, or sometimes coupled with palpitations and limitations in my endurance. And this is something that I don't really notice as much when I'm exercising, when I'm working out, or when I'm doing my recovery rehab. It's actually something that I notice throughout the day when I'm working. Typically, I get a little sleepy mid-morning. I would yawn. But beyond that, throughout the course of my day at work, typically, I would find myself needing to take momentary breaks, to take long, deep breaths, and then just generally just stop what I'm doing, whether it be walking or working with a patient or whatever as part of my daily responsibilities. I'd have to sit down and consciously breathe and relax and recover, because I do feel myself feeling winded. Again, it's not something that I notice when I'm working out, as you see me doing here right now, but it's something that I notice throughout the day when I'm pulling in grocery bags, or when I'm bringing the laundry downstairs. Regular mundane things that I would be doing throughout the day, and that's when it would hit me. That's when I would notice these levels of fatigue and breathlessness. And again, this is about 3 months and a week after the lung surgeries, and it's pretty regular too. I do see this, on a daily basis. It's not something that just happens, you know, once in a while. But no, it is something that I notice, every day, that I will have these moments, and they don't last long. They don't linger too long, but they're long enough to be noticeable. Is I guess what I'm saying. The next thing that I also notice is the site around my chest, towards the right side of my chest, that numb spot just underneath the my right nipple. It's numb for the most part. It's about the size of the palm of my hand, but immediately around that site is an area of sensitive skin where it just kind of hits me and causes an irritating amount of pain that's unpredictable. Sometimes, it's tingling. Other times it's itchy. Other times it's like a shooting sensation. And it typically wasn't as uncomfortable maybe a month or 2 months ago. But nowadays, when it hits me, I can tell. I can really notice. It kind of stops me dead on my track. But the worst part of it is that beyond the sensations is a feeling of heaviness and tightness right around my chest, which is kind of concerning. Is that from the wound, or is that from the damaged nerves from the surgery, or is that my heart? And I know it's not, because I just had an EKG and 2D echo, and everything is working as they should be working. So I know that tightness and heaviness sensation that I feel around my chest wall is really related to the abnormal or abnormalities from the nerve damage. And yet, it's bothersome enough that I notice it, most of the day, every day, really. It's not something I can just kind of um, put off to the side. I can feel it. It's a part of me, I guess, is what I'm saying. So that's the second thing that's still lingering, from the surgery. And finally, the last thing that I want to tell you is that weakness. I still feel a significant amount of weakness. Case in point, grocery bags, bringing them in or lifting groceries. A couple of bags pose a challenge to me. So my grip strength and my ability to lift things, to move, not just my upper body, my arms, but equally my legs. I'm probably half is the general strength that I'm capable of doing now. So definitely, having been deconditioned from from the surgery and all the bed rest, um, and the lack of activity that I've had to go through these past several weeks, these past 3 months, have all really affected, what my physical capabilities are at this point. So I'm hoping that over the next several weeks, over the next several months, as I continue to work throughout my routines, I will begin to recover, my strength and my physical abilities. And hopefully, sooner rather than later, I can start to get out there and begin my runs. Um, Thank you for joining me today. I really appreciate your company. If you've undergone surgery yourself, be it similar to what I have gone, or something closely similar to it, let me know. Tell me, what are some of the things that's been lingering for you? Have they all gone away eventually, or do they continue to bother you, 5 months, 6 months down the road? Most people recover about 90% of their prior abilities, about 9 months after the surgery. So, that's a heck of a long time to recover. I'm hoping that I can do it sooner than that. But let me know your experience. Chime in. I'd like to know. So I guess that's kind of where I'm at today. Again, once more, thank you for joining me in my journey. I really appreciate your time and your company throughout this process. Until the next one, I'll talk to you soon. Have a great one. Bye.